Welcome back to this last video in the cardiovascular series. This time we're going to talk about some interesting cardiovascular diseases. So let's start first with the EKG abnormalities. I know we didn't talk about how to read an EKG. That's beyond the scope of this, but most of you have watched some TV shows, so you may have heard some words. Want you to realize it's very easy to diagnose when somebody is having a heart attack by EKG. So this is what a normal EKG looks like. It's got these waves. Doctors, we're not that brilliant. We name these waves the P, the Q, the R, the S, the T wave. Yes, in alphabetical order. They represent atrial systole, where we have atrial depolarization, then we have ventricular depolarization, then we have ventricular repolarization. Yes, there's atrial repolarization, but it's hidden by this big ventricular depolarization because there's a lot more ventricular muscle, so that's why it hides what's happening with the atria. All right. So when you're having a heart attack, what happens is this part of the curve, which is normally at the baseline, this part gets raised up. So instead of being flat here, do you see how it gets raised up in the air? Yes, it gets raised up and it'll stay that way for a certain number of days. And then at some point in time, this T wave actually flips upside down, and it will stay that way for a few weeks before eventually it gets returned back to normal. And so when we do EKG, we have like 6 leads on the chest, and then we have leads on all four, well, 3 of the extremities and a ground on the 4th extremity. And so we end up with 12 different leads because they're giving us different angles through their heart. And so which lead shows us these patterns tells us which part of the heart has had the insult. So we're able to tell what part of your heart had the heart attack. Now, if the SA node is not sending an impulse through the atrium, we don't get this lovely P wave, and instead the atria act like a jello jiggler, and they just fibrillate, we call it. And so that's called atrial fibrillation. So you just see all this little wiggles going back and forth. Now, what happens then is the atrioventricular node will set a rhythm. It sends its impulse through the bundle of His, but the heart rate will be somewhere between 50 and 60 instead of the normal 60 to 80. And it won't be a steady rate like with the sinoatrial node. So you can see here, we still are getting the normal ventricular complexes, but they are irregular in their spacing. So that's what atrial fibrillation is. Now, you may have heard of VTach, where the ventricles are contracting so fast that it's like 3 times the normal heart rate. Ventricular contractions are like at 180 beats per minute. So there is no time for ventricular filling. So there's no blood coming out, very little blood coming out. Because like normally when your heart rate is around 72, you've got somewhere between a quarter cup and a half a cup of blood coming out with every cardiac cycle. Well, now your heart's beating 3 times faster. So like you're lucky if you got a tablespoon or so of blood coming out with each cardiac cycle. So this is not compatible with life very long. And in fact, if you're older than a teenager, you're going to be totally unconscious. And if you're a teenager, you're only going to be conscious if you're like lying on a bed. So we need to get rid of this rhythm, but there's one even worse, and that's if your ventricles aren't able to have that contraction at all, and they do that little fibrillation thing called V-fib. Yeah, not good at all. So let me show you a rhythm strip of an actual patient that was in VTach, and so it was decided, well, that's bad, so let's do what the layperson would call shocking the person, or what is known as cardioversion. So here's the thing with cardioversion, there's no guarantee it's going to work. And so here is a cardioversion done to the patient. And what you can see has happened, we took the patient out of VTach and put them in VFib. Not good. So cardioverted them a second time, and they stayed and VFib. And so cardioverted a third time, and they actually came back in a slow rhythm, and you could see evidence of myocardial damage, but at least the person had some kind of a cardiac output. Anyway, that was just interesting stuff about the EKG. Not going to ask you any of that stuff on the test, but just wanted you to realize it. But the EKG does tell you a lot about the heart function, and that conduction system of the heart correlates exactly with what you're seeing on the EKG. Now, when that conduction system fails, when you have the atrial fibrillation, that's the #1 cause for putting in pacemakers. Okay, so the pacemaker is this little battery-powered thing there, and to it are attached these wires, and these little leads get placed in the heart. Specifically, there's one put by the AV node just above the tricuspid valve, and the other one is put down by the apex of the heart. And so it's threaded in through the subclavian vein, through the superior vena cava, down into the right atrium and the right ventricle. And then the battery pack is buried in the chest. Okay. Battery pack is fine. The batteries are going to last 3 to 5 years. You get checked every 6 months. We have plenty of notice before the battery dies. It's a very simple procedure to change the battery. It's done under local anesthesia. Don't worry about it. That's not a problem. And so this can keep you alive, keep you healthy, able to exercise, all kinds of stuff. Pacemakers cost anywhere between $10,000 and $100,000 because pacemakers can do a variety of things. Now, a garden variety pacemaker, which just has a steady heartbeat to keep you walking around the house, doing your laundry, your normal activities of daily living, that's going to be your $10,000 pacemaker. Now, a pacemaker that needs to recognize when you have arrhythmias and give you a cardioversion, that's going to be a much more expensive pacemaker. So there's all different kinds of pacemakers. Here's a hint. If you're a 95-year-old, you're not going to be getting the $100,000 pacemaker. You're going to be getting the cheaper version of the pacemaker. Okay, so pacemakers definitely lifesavers. Let me talk about high blood pressure, which is known as hypertension. So if we look at data that was done in the year 2000, back then we knew by the age of 35, about 5% of people had high blood pressure. And by the time you hit about 50, maybe 30% of people. And so we said by the time you hit 60, or 65, about 50% of people would have high blood pressure. Well, look what happened in just 10 years' time. Okay, so in 10 years' time, by the time you hit 60, it was 66% of the people. By the time you hit 50, 1 in 2 people have high blood pressure. And let's take it down to the college age. Over 8% of 20-year-olds by the year 2013. And now we know by 2020, it's more than 10% of people in college have high blood pressure. So it's due to lifestyle changes, dietary and lifestyle changes. If we look specifically in the US, there was a great study done by the National Institutes of Health in 2016. This is their data. 45% of US adults had high blood pressure. That was more than 100 million people. So if you are going into any kind of health care in the United States, 1 in 2 of the adults you are going to see have high blood pressure. Okay, so 50% of the adults are going to have high blood pressure. If we look at those adults with high blood pressure, only 80% of them know they have high blood pressure. In other words, 20% of the people with high blood pressure are walking around not knowing it. Why? Because they don't get their blood pressure checked and they don't see any people about their health care. Yes, especially in California, that's terrible because we have so much free health care available for people. Okay. Now, 87 million Americans have recommended lifestyle changes or prescription medication for their high blood pressure. Okay, so 80% have been diagnosed and have been told, do this lifestyle recommendation, change your diet, start exercising, start walking, do this, and take this medication. But here's the thing. Of the 80% that have the recommendations, 1 in 3 choose not to do it. Yes, 1 in 3 know they have high blood pressure and have decided, for whatever reason, I don't care. I don't have any symptoms. I'm not going to deal with it. And 75% that we have diagnosed with high blood pressure aren't controlled. Maybe they've been given a prescription to treat their high blood pressure, but they've decided, I'm going to work on my diet. But they're not doing it seriously, working on their diet. Or I'm going to start exercising. But that means, okay, I walk 1 day a week. And I just walk half a block 1 day a week. Okay, so they're not serious about it. So this is why people are dying. Okay, if we look at Hispanics, and I do that because here in California, we have a lot of Hispanics, 45% of Hispanic men 20 and older have been measured. Somebody has taken their blood pressure and they have hypertension. Or if they have normal blood pressure, they have been taking hypertension meds. Okay, that's ages 20 and older for Hispanic men. And for Hispanic women, it's almost 30% that we know that. And this was a study done between 2017 and 2020. So these numbers are much more realistic for the current status for Hispanics in the United States. Looking at hypertension, the risk factors are smoking, dietary fat intake, dietary salt intake. Think about your diet. Are you eating out at restaurants? Then you automatically have high fat and salt intake. Are you overweight? Are you obese? Do you have a sedentary lifestyle? Okay. By that, are you exercising at least 30 minutes for 6 days a week, or doing vigorous exercise at least 3 to 4 days a week for an hour? If not, you're considered sedentary lifestyle. Do you have a lot of stress? Now, I know since COVID, all of us have stress. And with the elections, we all get stressed. What are you doing about it? Are you just moaning and complaining? Or are you seeing a therapist? Are you doing yoga? What are you doing about your stress? Have you changed jobs if your job is giving you stress? Okay, then let's talk about your sex. Men are more likely to have high blood pressures because women, we have hormones that help us until we hit menopause. So yes, both sexes. So postmenopausal women as well as men. And then the Black race, and that's because they process their salt differently. So any salt intake in the Black population affects them differently. So if we look at the prevalence of high blood pressure in 2020 in the United States, you can see in the parts of the country that have a Black population, the prevalence is quite high. Whereas if we look here in California, where we had a lower population of Blacks, we look like we're great. But if we look at mass, specifically looking at the Hispanic population here in California, then we look terrible. Okay, this was overall, and it's because we don't have the same ethnic backgrounds, why we don't look the same. All right, so this is what a blood vessel looks like when you get hardening of the artery. So instead of an artery having that elasticity so it can stretch out when the blood comes, it becomes a rigid tube like a pipe, which means then the heart has to work harder, has to pump harder. So it's just like when you build up your muscles when you're going to the gym and your muscles get bigger and bigger, and you like that on your abs because you get that six pack, or you like it here when you see that biceps bulge. Well, we don't like it when we see this in your left ventricle. See your small right ventricle? It doesn't have to work so hard to pump blood to your lungs because that's only 2 inches away. But when your left ventricle has to pump because your aorta, instead of being nice and open and 2 to 3 inches and having this elasticity, has become this rigid pipe, now the left ventricle, instead of being half an inch thick, has become 2 inches thick. Look how tiny the middle of it is. It can barely contain any blood. That's not a good thing. Okay, so the consequences of having high blood pressure are heart attacks, heart failure, stroke, kidney failure, more hardening of the arteries known as atherosclerosis, going blind, being impotent. Men, that's enough to get you into seeing the doctor. Having toes or feet amputated, death. You want to die early? Don't treat your high blood pressure. And if we look in the United States, there was a 38% increase in the number of deaths due to high blood pressure over a 10-year period between 2005 and 2015. So that's before COVID. That's before we had the stress and the sedentary lifestyle associated with COVID. So imagine what has happened since COVID. Sure, those numbers have skyrocketed since then. We just don't have the data since then. All right, so let's look at the risk of heart disease. If you have just high blood pressure, your risk of heart disease goes up 1.5 times. If you have diabetes, it almost doubles. If you have high blood pressure and diabetes, it goes up 3 times. If you have high cholesterol, thinking about your diets, anybody? That goes up 2.5. But look, if you have all 3, it has gone up 6 times. So let's try protecting your heart and not get heart disease. Manage your cholesterol, manage your blood sugar, manage your blood pressure. Go see your primary care person. Get that health check. Okay, if you're in college, you need to go. You get free blood pressure checks on every college campus in the United States. Go get it checked. Start eating healthy. Your college campus can give you. They've got dietitians that can work with you. Start moving more. Walk on campus. Every campus has a walking club. Stop vaping. Stop smoking. Drink less alcohol. Yes, we know you think you're in college and you start drinking. If you are going to drink, quit doing shots. Okay. 6.5 million aged 20 and older are living with heart failure. Don't become one of them. Here's the death rates for heart disease. Yes, the South with their high blood pressure, but look at California. Not so great, are we? All right, Hispanic adults, Blacks. I don't think I brought the whites table in there because I wanted to show you that 350,000 cardiac arrests occur every year outside the hospital. So if you have loved ones that you live with, or that you know that have diabetes, high blood pressure, high cholesterol, any of the risk factors for heart disease, please go to the American Red Cross or anybody else and take a CPR class and get trained in how to do this. You could save somebody's life. All right, let's talk about atherosclerosis, hardening of the arteries, if you've ever heard of that. And for this, I want you to look at a pipe that is clogged. All of us have had clogged kitchen drains or bathroom drains. Bathroom drains is typically some lady's hair has clogged it. Kitchen drains, don't put your fat, Thanksgiving, don't run fat down a kitchen drain, let it solidify, put it in a container, throw it in the trash instead. So here's how atherosclerosis happens. Your dietary cholesterol. Your body doesn't like it. Okay, it gets carried in your blood on a protein. And then what happens is it gets deposited in the walls of your blood vessels. And it causes an inflammatory reaction. Remember that whole inflammatory reaction we talked about, releasing the cytokines and all that kind of stuff? And so you're going to have that whole inflammatory reaction with the histamine and all that. And what happens is the smooth muscle in the wall of your arteries, you're going to start having smooth muscle because it wants to make a smoothness on the top of the cholesterol crystals on the top of it. And so that's going to make that blood vessel even narrower than just the blob of cholesterol crystal that made it narrower to begin with. And this happens again and again and again. So here's the cholesterol and then the smooth muscles on top of it. And that's why you have a smooth lumen. So here's cholesterol crystal. And then here, like you can see it all breaking down there, but like here is smooth muscle on top of it. And look how small the lumen is. Like the lumen over here, it's like we've lost 80% of the lumen of this blood vessel. Here we have lost about 60 or 70% of it. And here we have lost about 90% of it. And then what happens is maybe you move wrong. Maybe you go out and exercise. Maybe you get dehydrated. You have some beer and, instead of drinking water. Or maybe you go out to celebrate somebody's birthday and you have ribeye steak and mashed potatoes with sour cream and maybe some creamed corn or creamed spinach, and maybe you have birthday cake or you have cheesecake to celebrate, and all those lipids being carried in, and now you have a blood clot. Okay, now look at this blood vessel. This blood vessel was only about 40% occluded with atherosclerosis, whereas these are much more occluded. But the blood clot took this one down to like 85%, and that was enough to kill this person. Oh, so if we look in our country, there are 56 million people age 40 and older who have high blood cholesterols and are eligible to take medication. Why? Because their diet is not such that they are lowering it. Because they don't want to become vegans. They want to eat their meat. So get put on the medication and take the medication religiously so you don't do this to your blood vessels. You're not going to be reversing this, folks. Okay, you can't call Roto-Rooter to scrape this out like you can with your kitchen sink. So let's talk about how atherosclerosis starts, because it doesn't start like this. It starts like this with little streaks of fat. This is what it used to look like when you're in your 30s. Now this is what it looks like with 5-year-olds. Why? Because we take them to McDonald's and we give them Happy Meals. Think about that before you start treating your kids to Happy Meals, okay? This is what it used to look like with 40 to 50-year-olds. You can see two significant areas with cholesterol deposits and plaques there. This has been narrowed a good 40%. Ladies and gents, this is what you guys are looking at in your 30s. All right. Now, this is what it used to look like in your 70s. It's not your 70s anymore. These are very complicated plaques, and you can see that pieces of the aorta can be breaking off, and you can see how it's blocking blood flow to these kidneys, which have all shrunken down because they're not getting their normal blood flow. So this person's like in renal failure to boot. Okay. Now, these cholesterol deposits in the wall can weaken the wall of the blood vessels and give you aneurysms. And aneurysms are when you get outpouchings at the sites of weakness. So in your brain, we often get what we call berry aneurysms. Why? Because they look like little tiny, like little blueberries, except they're not blue. Okay, so here are examples of berry aneurysms in the blood vessels, the major blood vessels in your brain. We also can get big ones like little sacs. This is on your heart would be here. So this is on the arch part of your aorta. And these are the main blood vessels, which would be going to your head and to your upper extremities. And this is a classic kind of aneurysm that you would get with syphilis. So think about that. Make sure you get your STDs treated. And then we can get a fusiform type of aneurysm in your abdomen. And this person actually has 2 of them in their abdomen and then 1 here going down to their right leg. And this is a very common type that you see with atherosclerosis. And these we would repair once they get to be about 6 centimeters in diameter. And the reason we wait till 6 centimeters is because there is a couple % risk of death from doing this operation. And at 6 centimeters, the risk of this rupturing equals the risk of death from the operation, because all of these can rupture, and that bleeding, you get massive bleeding and can cause death. Obviously, the ones in the brain, you get a massive headache and you tend to die. Yes, all of these, you tend to die. And here is a picture of somebody who had a massive bleed. You can see the big, huge blood clot from the ruptured abdominal aortic aneurysm. That's what the AAA stands for. All right, so now let's talk about 2 things, angina and myocardial infarction. Those are the clinical terms. And I'm going to talk about these because there's 16.5 million Americans who are living with coronary heart disease. So what happens is if blood flow to the heart is occluded, and here is a coronary artery with a fresh clot in the coronary artery, it is glistening, and as you can see, it 100% has occluded this coronary artery, and this looks like it is the main coronary artery going down the front of the heart, so it's feeding the left ventricle. We call that the left anterior descending artery, also colloquially known as the widow maker. Why? Because it kills you and makes your wife a widow. But if it's not completely occluded, as in this one, it's going to give you chest pain known as angina. And the reason why it gives you chest pain from your heart is because the heart muscle there is not getting adequate perfusion. So it's not getting its normal blood supply. So the heart still has to keep on, it's still beating, and it's still contracting. And so it's not getting its normal supply of red blood cells, so it's not getting its normal oxygen supply. So it's having to switch from using oxygen for energy source to using fermentation. So it's building up lactic acid, and that is what the pain is. So when you had like your leg cramps from lactic acid, this is like your myocardial cramp known as angina. Okay. So what happens with your heart is if you have this angina, whatever people were doing, they stopped doing it. Why? Because this hurts. Okay. So if you were playing tennis or you were walking, whatever you're doing, everybody stops. Okay. You stop your activity. And so then what happens is your heart rate will slow down. So then the need for oxygen will decrease. And if you've had this before, you have your little bottle of nitroglycerin pills, which will dilate your coronary arteries to increase the blood flow. And if you don't, you still will usually increase your blood. Well, you'll still have the same blood flow, but you'll decrease your oxygen needs. So then you will have less fermentation because you've decreased your oxygen needs. But if you don't do that after 20 minutes, what is going to happen is those cardiac muscle cells are going to die. So if we take this person who had a blockage to their widowmaker, we can do a special stain on the heart. And if you look at all of this yellow area, this is showing where the muscle has died. And as you can see, it's almost half of the anterior surface of the heart that was fed by that blood vessel. Okay, so yes, this person obviously died. That's why we have this person's heart. And when heart muscle die, it's called a myocardial infarction. And this is what you have been calling a heart attack. The layman's term is a heart attack, but the medical term is a myocardial infarction. Myocardium, that's heart muscle, myocardial infarction. Now, if it's a smaller myocardial infarction, it's not going to kill you. You can live with it. But you're going to have the myocardial muscle cells are still going to die. And so what is going to happen to them is there is going to be a scar formed in that area. So that area, those muscle cells never come back. They will never contract. So only the other muscle cells will contract. So this part here, it can become an aneurysm. It's going to be totally dysfunctional. So you can go into heart failure in a couple of months after myocardial infarction. You can be released from the hospital and do fine for a couple of months and then go into heart failure if the scar is big enough. All right. And so there are 1 million people who will have a heart attack or die from coronary heart disease every year in the United States. Now, a cerebrovascular accident, cerebrum, the main part of your brain, vascular, the blood vessels. Okay, this is what the layman person calls a stroke. And there are almost 1 million people in the United States who have a stroke every year. There are two types of stroke. 80% of the strokes are what we call ischemic strokes. So this would be a blood vessel going to the brain that has an area of atherosclerosis. And so you get a clot in that area. So the same thing that I showed you there that was causing the angina or the heart attack. Okay. And so here's an example of somebody who in their carotid artery going up to the left side of their brain. Here is the left internal carotid artery. So this is the main carotid artery going to supply the entire left side of the brain. And right here, you can see the blood clot to the entire left side of the brain, blocking out the blood supply to it. So that's going to be a massive stroke, as opposed to a picture I'll show you later, or this picture here, which is just going to be going to this area of the brain. Now, the other type of stroke is when, like, for instance, if you had a berry aneurysm or any other kind of weakness and the blood vessel bursts, and so you get hemorrhage into the area. Now, it's very important that in the emergency room, they determine which type it is, because if you get to the emergency room within an hour, if it's due to a blood clot, there's medications that we can give you to bust this clot so that you can start getting blood through this. So we can try to save some of these neurons here in your brain. But if we gave that medication to somebody who had a hemorrhagic stroke, we have just now given them a huge, massive bleed and killed them. So yeah, we can't do that. All right. So here's an example of somebody who has a hemorrhagic bleed because we give the dye and the in the blood vessel, and so it shows up white in the brain. So as opposed to heart muscle taking 20 minutes to die, neurons start dying in 5 minutes, and about 2 million will die every minute. And I put a picture here of a 33-year-old that had a stroke to remind you, you can have strokes at young ages. It's not just grandma, especially if you have untreated high blood pressure. Number one cause of having a stroke. Okay, so here's an example of an angiogram looking in the brain. And can you see how we've got great blood flow to here, and then all of a sudden that blood vessel got super, super skinny? It's because there is a blood clot blocking about 90% of that blood vessel. So here is a CAT scan showing that in the normal brain of the same person that had been taken earlier, now there is this whole dark area right there because this person had a stroke affecting a pretty significant part of that side of their brain. If you look at a brain where somebody has had a recent stroke, you can see, like, here's normal gray matter, and then underneath it, you can see normal white matter. And then this part right here where it all looks super soft and super squishy, this is the area of the brain that had the stroke. And then this is somebody who lived quite a long time after the stroke. And so what happens is you have normal cells in your brain, which will eat up all this necrotic dead material over time. And so this person lived for years after their stroke. And so basically that's where their stroke was. And so they've just got like that hole in their brain where the stroke was. All right, so that's all I want to talk about. If you're bored next Easter, take your peeps and do what, we anatomy instructors do, and like we're pretending we're doing open heart surgery with our peeps. So thank you so much for all your work and studying and putting the effort in as we learned about the cardiovascular system. And I hope to see you again when we tackle the next organ system.